Cardiovascular disease is a huge global public health issue, so it is really important that we take a comparative lens when we're analyzing this issue across the world. Cardiovascular disease kills about 18 million people a year, and it is the leading cause of death worldwide. There are many risk factors that are actually really preventable through lifestyle changes. So it is really important that we look at different prevention programs in order to determine what's the most successful in different nations. In the United States, there's a life expectancy of about 76 years. The United States has a mixed healthcare system. So this means that they have a mix of private, public, and out-of-pocket expenditures. As you can see in the pie chart, about 48%, so almost half of the American population, has employer-sponsored insurance. So this means that they use private insurance to cover their healthcare costs. But a large portion of Americans use the public healthcare insurance. So that's going to be Medicare, Medicaid, and the VA for veterans. But there's also a large portion that go uninsured. So this means that for any healthcare expenditures, they're gonna have to pay that out of pocket. So this mix of a healthcare system is really interesting to see how it plays out in the United States and how that translates to different prevention programs and different healthcare outcomes. Some of the pros of the United States healthcare system is the research and innovation that it is known for. Also, choice in provider and hospital system is really interesting because that is really important to a lot of people to be able to choose their providers and choose what specialists they go to. Another thing that is good about the United States healthcare system is the shorter wait times compared to different countries. Some of the cons are the financing. So like I mentioned before, the large portion of Americans that go uninsured and have to pay a large out-of-pocket cost for some basic healthcare needs. There's also a large issue with access to care. This can be due to many different kinds of barriers, being physical, financial, things like that. And another huge con of the United States healthcare system is the cost of pharmaceuticals, and this is due a lot to the privatization of the pharmaceutical industry here in America. We see that there's not a lot of negotiation between systems and the pharmaceutical industry. In Spain, there is about an 82-year life expectancy. Spain actually has a universal healthcare system, so this is going to be the public healthcare system that exists in Spain. So about 90% of the Spanish healthcare system is going to, 90% of the Spanish population is going to take use of that public healthcare system, and then 10% are going to opt into private healthcare. So some of the reasons that one may choose with private healthcare are wait times, more comfortability with the providers, and more comfort when they're at the doctor or seeing a specialist. On the right, we see a graphic that compares the public versus private healthcare systems in Spain, and we actually see the public system doing really well with technology, service, and skill. So some of the pros of the system, like mentioned, is the overall coverage of their citizens, the quality and improving the overall health status of their citizens. They do really well with that year after year. Some of the cons is the limited choices in not only hospital systems, because the Spanish government has their own hospital system and employs the providers, but in the providers as well, because there's not a lot of choices in what specialist you want to go to. There is the one in your area that is provided for you through the public healthcare system, so that's where people have to go. Again, that might be another reason why that 10% of the Spanish population does choose to go private, because they want to have that choice. And another con is wait times. They are improving their service every year, but wait times do suffer under this public healthcare system. Albania has a life expectancy of around 78 years, and they also have a universal healthcare system. However, this healthcare system is in a transitional period in their time. So Albania used to be a communist country, and there are a lot of issues with the government transition as well as this new universal healthcare program. So there are a lot of issues with this program in addition to the pros that exist. So the attended coverage for all is a huge pro, and the Albanian healthcare system has a huge focus on primary care, which is really awesome, especially from a public health standpoint. Some of the cons, like I mentioned, are the financing. Albania doesn't truly have the funds to provide universal healthcare to all of their citizens like they would want to. They are improving it as much as they can, but they just have insufficient funds to really provide the correct healthcare systems needed and to employ the correct providers that would be needed for the population that they have. Another huge issue is access to care, and this is actually a physical access to care. A lot of the health clinics and providers live in the cities of Albania, whereas most of the population lives in the rural outskirts of Albania. As we see in 2018 on this right here, Albania was listed last for total health in Europe. When looking at cardiovascular disease in America, we see that it is the leading cause of death, and it takes about 42% of all deaths in America. What's interesting is that it is the #1 death across different genders and ethnicities. So we see different proportions and different death rates, but overall, across the board, it is still the leading cause of death for each different demographic. Some of the top risk factors are high blood pressure, obesity, and high cholesterol. In our graphic here, we see some fun facts that are actually really sad about every 33 seconds, someone in the United States dies from cardiovascular disease, and we see that more Americans die of heart disease than all cancers combined. So some of the prevention that the US has is through the CDC, and these are going to be programs that are focused on intervention and education, where the CDC will go into communities and try and educate the community on changing lifestyle to prevent these risk factors like obesity and high blood pressure and cholesterol and things like that. There's a lot that you can do as an individual to change that. So a lot of these programs focus on intervention. However, there is little support from legislation and policies to really give these programs sufficient resources to be efficient and truly implement what they're trying to do. In Spain, cardiovascular disease is also the leading cause of death, and it is about 32% of all deaths, so that's a big decrease from what we saw in America from 42. Some of the risk factors of cardiovascular disease in Spain are high blood pressure, cholesterol, tobacco use, and diabetes. What is interesting about this is that obesity is not listed in the top risk factors for the Spanish people when it comes to cardiovascular disease. When it was in the top 3, it was actually top 2 for Americans, and that's really interesting and will play into the cultural differences between the two nations when it comes to heart disease. Spain has a unique interest in cardiovascular disease prevention because they are the healthcare system. The government is the healthcare system. They are financing it. They are the ones providing it. So they're going to take not only a unique interest in it and a special interest in prevention, but they also have more resources because they control the entire system. So some of the programs that they do are, well, first of all, the prevention is very well funded and well enforced. So some of the programs they do is a huge focus on primary care. They do a lot of initiatives that are focused on primary care providers and really hammering down the risk factors and trying to negate these before they really become an issue in their patients. So this is something that a patient's primary care doctor will be watching for throughout their life. And that's something that Spain does a really good job with. Some of the other programs that they have are research studies, specifically childhood research studies, where they're constantly doing research on what they can do better for different prevention programs, and then actually using that when they're implementing policy. So it's this constant cycle of research influencing their policies, and that's constant. That's a constant cycle. So they have the resources to do this research and implement these policies, whereas the United States doesn't have that backup of the policies like Spain does. So this is a big contrast to the US programs where the CDC really just focuses on intervention and education, whereas the Spanish government is integral in their changing policies, changing the system, and doing a lot more to the actual healthcare system's focus on cardiovascular disease. In Albania, they don't have a lot of research on cardiovascular disease as an umbrella term. Instead, they focus on coronary heart disease, which is what I talked about in that first slide with the heart attacks. So that is the leading cause of death in Albania. And they do a large focus on non-communicable diseases, so cancer, and that includes cardiovascular disease. And so they actually just implemented this big initiative that is backed by the government, hopefully is going to be well funded by the universal healthcare system, and that'll be really interesting to see how it turns out in these next couple years here, and if that'll decrease their proportion of deaths due to cardiovascular disease. Overall, we see that there are a lot of differences in not only the statistics of cardiovascular disease prevalence in different countries and the death rates, but the approaches that different countries take, and this is largely due to the differences in healthcare systems and the differences in the government's priorities. Thank you.